In the heart of West Africa, a deadly virus has resurfaced, one that has left families mourning, farmers desperate, and health officials scrambling. This is Rift Valley fever, a disease that has already claimed the lives of at least 17 people in Senegal. Rift Valley fever outbreak, Senegal 2025, Scene 2, 045 to 2 Sao. What is Rift Valley fever? Animated map of Africa showing Rift Valley region and transmission cycle. Narrator. Rift Valley fever, or RVF, is a viral disease carried by mosquitoes and spread through contact with infected animals, especially cattle, goats, and sheep. It was first identified in Kenya in the early 1930s, but today it's re-emerging across Africa due to climate change and poor livestock management. Expert. When there's heavy rain followed by hot days, mosquito populations explode. And that's exactly what we've seen in Senegal this year. Scene 3, 2 Charto 330. The outbreak begins. Footage of rural Senegal. Farmers, livestock, local clinics. Narrator. The first cases appeared in late September 2025 in northern Senegal, among herders who had just begun the seasonal migration of their animals. At first, it looked like a routine livestock illness, but soon, herders began falling sick with high fevers, nausea, and internal bleeding. Text on screen. Confirmed cases 119, deaths 17, as of October 10, 2025. Narrator. By early October, hospitals were overwhelmed, and the government declared a health emergency in several rural districts. Scene 4, 335. How it spreads. Animation showing mosquito bites, animal blood exposure, and human infection. Narrator. Rift Valley fever doesn't just spread through mosquito bites. It can also infect people who handle blood, tissue, or organs of infected animals, a dangerous risk for farmers, butchers, and veterinarians. Cut to short interview clip, local veterinarian. We lost several animals before realizing it was RVF. By then, some of us were already sick. Narrator. The virus kills quickly, but it can also cause blindness, brain swelling, and long-term damage in survivors. Scene 5, 5 Duor 630. Impact on people and economy. Shots of empty markets, farmers burying animals, grieving families. Narrator. Beyond the human cost, the outbreak is devastating Senegal's rural economy. Livestock markets have closed, animal exports have been halted, and families who depend on milk and meat sales have lost everything. Text on screen. Economic losses. Estimated over $12 million. Local livestock sector. Narrator. For small farmers, this outbreak means hunger, poverty, and fear of losing the herds they raised for generations. Scene 6, 638. Okay. The government and WHO response. Footage. Health workers spraying mosquito areas. Vaccination campaigns. Narrator. The Senegalese Ministry of Health, with support from the World Health Organization, has launched an emergency response, sending medical teams to affected areas, distributing mosquito nets, and launching vaccination campaigns for livestock. Cut to Bachichu, spokesperson. Voiceover. Wachu, representative. Our goal is to stop the spread before it reaches urban areas. The key is to protect both animals and humans at the same time. Narrator. Drones and satellite data are even being used to map mosquito breeding grounds, a new approach in Africa's fight against zoonotic diseases. Scene 7, 8 Naekal 9 Sals. Climate and future threats. Footage. Flooded plains, rainstorms, mosquitoes close up. Narrator. Experts say the outbreak is a warning. As climate patterns shift, heavy rains followed by heat waves are becoming more frequent, creating perfect conditions for mosquito-borne viruses. Cut to Environmental scientist. If we don't strengthen surveillance systems and climate adaptation now, Rift Valley fever won't be the last outbreak we face. Scene 8. 9 Giza 10 Lizak. Closing and hope, footage, community awareness sessions, recovering patients, healthy livestock. Narrator. For now, communities in Senegal are learning to adapt, to protect, and to rebuild. The fight against the Rift Valley fever is not just about medicine. It's about resilience, awareness, and unity.
For human use.
If successful, the research and development of this vaccine, it will mean a major